Hi, this is Roy Lilley with my quick roundup of all the issues around liberating the NHS. I've got my piece of paper with 3 things to talk to you about. First of all, let's talk about GPs. All the focus of attention's been on GPs. Big question, can they actually commission in 600 commissioning groups? Well, the answer is that yes, of course they can, because GPs are not going to be the ones doing the commissioning. They'll be given an extra management allowance to buy in help from the voluntary sector, local authorities, the private sector, or perhaps if you're working in a PCT, you're already thinking about setting up a PCT consortia, social enterprise, perhaps to help the GPs do it. There's one thing to remember about GPs, and it's this: whatever you give them to do, beware, because they will always do it better than you think, and they'll always cost you more than they think. So I'm not kind of worried about that. I'm worried about the high-end strategic level, but locally GPs will sort themselves out. There'll be a punch-up over the consortium and who's going to head it up and all the rest of it. They'll fight like ferrets in a sack, but I think they'll sort that out. Now, the second thing I wanted to talk about, I think it's the more important thing that most people have missed, and it's this: that everybody becomes a foundation trust. That's fine. But it also says in the white paper that the foundation trust will have the opportunity to migrate into owner-run cooperatives, in other words, social enterprises. Now, social enterprises are just ordinary businesses like every other business, but they have a social purpose, and that social purpose is obviously in providing healthcare. There are some caveats around the distribution of surpluses. In the private sector, we call them profits, and that profit can be recycled back into the business, and yes, you can pay staff bonuses, and yes, you can do deals with the private sector. So effectively, if you think about all the foundation trusts becoming social enterprises, plus all the colleagues that are now working in the community that are being set adrift because they can no longer work for PCTs, they will have to go somewhere. Some will be vertically integrated into foundation trusts, and some will set up social enterprises of their own. So that's 2 lots of provision of healthcare effectively in the private sector. And of course, don't forget, GPs will be helped in commissioning by the private sector. So effectively, over time, this will mean that the provision of care, the provider side care, will be from the private sector. Also, the white paper talks about any willing provider can come in. So effectively, the NHS becomes a brand, with the commissioning board setting out the templates that people can use, NICE talking about care pathways and so on, Monitor making sure that the books add up, and the Care Quality Commission looking at the data, ticking the boxes and turning up and counting the dead, unless they can find a better way of doing it. So broadly speaking, we have a franchise, a template and a model, and the private sector will provide the services. Does it matter? Well, I guess to the guy in the street, he says, if I can get my health care quickly and it's good, do I care where it's coming from, providing I don't have to pay at the time that I'm going to use it? So interesting sort of management model issues and interesting moral and ethical dilemmas. And the final thing I just wanted to squeeze in is where this model looks so very much like the 1998 model of primary care groups, which of course was a Labour invention. And you can't see it, but on the screen here that I've brought up the objectives of primary care groups, and there are 3: improving the health and addressing health inequalities in their communities, developing primary care and community services across primary care groups, and advising on or commissioning directly a range of hospital services for patients in their area, blah, blah, blah. Effectively, what we've got here, Andrew Lansley has reinvented what we were doing in 1998. So we know how to do it. Good luck, and thanks for watching. See you next time.